I think the biggest thing that patients need to know about Brazilian butt lifts, which is sort of a misnomer, but fat transfer to the buttocks for gluteal augmentation, they really need to understand the procedure, the techniques, and the safety behind it. There are a lot of things on social media that are out there, and some are true and some aren't. BBL generally refers to doing gluteal augmentation with fat transfer, or injecting fat into the buttock to create more volume and a better shape. I feel a good candidate for a BBL. The number one thing I look at is, one, they have to have enough fat to transfer. There are a lot of women who come in who are very athletic, who are very thin. They just don't have enough fat reserves or enough to harvest. The other thing that I look at is actual skin quality. If the skin is basically a lot smoother, a lot tighter, and you know that when you do the liposuction, it'll sort of shrink down and create a better contour, I think that really makes a big difference towards the result to help shape the lower back and the bottom. And then, beyond that, it all depends on, the anatomy and the shape of their buttocks and what needs to be done. So the recovery process for a BBL, I think the main thing, in order to make the fat survive, because some of it may dissolve, in order to make it survive and make sure that the shape is maintained, I tell all my patients not to sit on their bottom for a month. They have to buy a special pillow that they put underneath their thighs so they're not putting pressure on their bottom, and they have to sleep on their side or their tummy. Related to safety, the biggest thing that we noticed, there were a lot of surgeons injecting into the muscle or underneath the muscle, and there was a much greater risk of the fat getting into the major blood vessels. So the new thing now is only injecting the fat subcutaneous or underneath the skin.